I start out by saying the adductors magnus. Now, if I got a magnus, I got to have another one. Magnus means big. Longus means
Long.
brevis means
Short.
and I got these three of the adductor group, but I got two more that we have to live with. Adductor magnus comes from the ischial-pubic ramus to the ischial tuberosity, and it goes down to the linea aspera. And it goes down to the adductor tubercle, which means it goes all the way down. The brevis and longus, inferior ramus, middle half and upper part of the linea aspera. These muscles are adductors of the hip. And I already said, why do I care? They're big muscles to hold my knees together. I'm really, really intrigued by holding my knees together. Now, if I look at them as an anatomist, what are they going to do? Hold my knees together. But look, let's look at them and, this is now called kinesiology. I used to call it clinical anatomy. There was a reason for that. One is it's more than kinesiology, and two, at that time I was getting a lot of athletic trainers wanting to come in the program, and I didn't want them to be able to argue. Well, I had kinesiology because the course was more than kinesiology. Now they've changed it, and that's okay. There's nothing wrong with it. I just, not the way I think about it. And for being here a week, I'm not going to rethink it. What do I need these adductors for? Well, they're probably going to be active in walking. Now, what they're going to do is bring my femur to here, right? What if my femur is back here? And I'm moving it to here. What is it doing? In addition to adducting, it is...
Medial rotation.
Well, yeah, but it is... Somebody said it here, except you're too shy to yell it out.
Flexing.
It's flexing. What if I have my femur here, and I lift my other foot up and use it? It's going to extend. So see, it's got a function in gait. Now, this is one of the things Donna Ryland said I didn't teach her when she was in class. Oh heck, I didn't teach Donna a lot when she was in class. I didn't teach her anything about myofascial release, and now she's a practitioner. She works on me. I have my feet here. I come up, I extend my hip. But what else do I also do? I'm extending my hip, but I'm also using my adductors to bring me to here. You have a patient. I used to think the adductors were sort of worthless muscle because they always got in the way. I was doing neurology patients, and they would work when I didn't want them to. In fact, you would inject phenyl alcohol into them to kill the nerve to the adductors to get them to not work. Otherwise, if they work when you don't want them to, you walk like this. Okay? But hey, my little old lady cannot stand up. Well, I need to strengthen the gluteus maximus. But the other thing, and Donna convinced me of this, you put a pillow between her knees and have her do this. Because the adductors are also involved in extending the hip in sit to stand. Because they are hip extensors. Okay. Now, for doing that, I'm not even going to care about the quads. Because the quads are in a lousy position to do much and sit to stand. Now, am I saying they don't work? Sure they work. But if I got to have my priorities, I'm going to work on the gluteus maximus and the hip adductors. And I think if you feel here, you come up, you will feel some action on the hip adductors. Okay, now those are the major adductors. There are a couple more, I think I've got a list here. Pectineus. Superior ramus and pubic tubercle. to the pectineal line. Pectineal line. That is from the lesser trochanter down to here. So it's in there. And it is an adductor, possible medial rotator. Gracilis, anterior body in the inferior ramus of the pubis, to the medial surface of the body of the tibia. We have a triple crown winner. Think about the dude who's sitting on top of that horse on a pretend saddle, who's got his knees out like this, holding on for dear life, while he's got one hand. What is he using? Adductors, but particularly the gracilis is most active in some hip flexion. So it's often called the horseback riding muscle. Okay, I will let you look up in the textbooks the lateral rotators. The gluteus maximus is the one we think of most, but we also have these little muscles, piriformis, obturator, internus, externus, gemellus, superior and inferior, and quadratus femoris. There's a lot of little muscles in there. They are external rotators. I don't ever remember spending a lot of time strengthening them. Some of my colleagues do, because they form the floor of the pelvis. If you're going into women's health issues, particularly incontinence, now this applies to men too. I will tell you something though, about men and incontinence. They're the best patients. Because we don't understand pads, ladies. We just don't. We're incontinent, we'll do whatever you want. Ladies too much, just accept incontinence. You know, I'll wear a pad. My wife is like this. I can't get her to do the exercise. She does in 2 days, and she says, well, they didn't work. Well, if she's going to strengthen her upper extremities, she's not going to do it in 2 days. Okay, you will study those muscles. Now, the one I want to mention is the piriformis. Remember we mentioned the sciatic nerve? The sciatic nerve comes off of the lumbosacral plexus, forms, and passes deep to the piriformis muscle. Sometimes it passes through the piriformis muscle. And if you get muscle spasm in those muscles, you're going to have back pain, or hip pain, or leg pain. And you can ultrasound that all you want to, but until you get that piriformis to relax, it's just not going to happen. So you're going to, hopefully the physician's going to give them some Valium. I've tried a couple other things. I sometimes get unknown back pain. I mean, this just makes no sense. And I try all my techniques and it doesn't work. And finally I break down and go to the doctor. And the doctor gives me 6 Valiums, of which I take 2, and I'm over my pain. I have to go get back fresh ones because it comes around every 2 or 3 years. But I also, at the same time, stretch these. Now, if I want to stretch a lateral rotator, in what position do I move the femur? Medial rotation. Some of you, one person was saying, I don't think I've learned very much. Yes, you have. You've learned a lot. Okay? We just maybe make it a little bit better.